28-year-old male patient, Joseph, presents to the emergency unit complaining of a racing heart. The onset of symptoms was sudden. He's got no chest pain, no dizziness, and there is no history of syncope. The question is, what could it be? Hi, you are watching ED Files, and I am Dr. Thabo Mafa. Palpitations are very common in the emergency room. They can be as a result of a simple or a potentially life-threatening cause. And what are palpitations? Palpitations are an awareness of one's heartbeat, and this can be described as being too fast or forceful or sometimes irregular. What could be the possible causes of palpitations? You could have cardiac causes, or you could have non-cardiac causes or systemic causes. And on the other hand, you could have a person taking some medication or drugs or even stimulants that would result in palpitations. The cardiac causes of palpitations could be abnormal heart rhythms. An example of those would be supraventricular tachycardia or atrial fibrillation. Structural abnormalities of the heart can also result in palpitations. Non-cardiac causes or systemic causes could be anemia, hypoglycemia, that is low sugar level, and also infections or fever could result in palpitations. Drugs or stimulants such as caffeine, nicotine, or even the use of cocaine can result in a patient presenting with palpitations. So, when we examine Joseph, what are the things we need to look at? We have to look at his vital signs such as heart rate, blood pressure, sugar level, respiratory rate, and temperature. Also, look at the peripheral signs such as anemia. Is a patient pale? Or is there any cyanosis? This would suggest that a patient who is pale would suggest they are short of blood, and their overall system, the cardiovascular system, is trying to compensate for oxygen delivery. And a patient who is short of breath, the cardiovascular system would also be compensating for the low oxygen delivery. Hence, there would be a fast heart rate. Also, do some systemic examination, not forgetting to examine the thyroid gland, which is a gland that sits in front of your neck. An overactive thyroid could stimulate your heart to beat much faster than it's supposed to. And also, you need to look out for signs of substance abuse. A patient who injects himself with drugs like cocaine and others, recreational drugs, could have marks in their body that would suggest that they are using drugs. And use of drugs can affect your cardiovascular system, and the patient can present with abnormal heart rhythms. How do we investigate a patient who presents with palpitations? We need to have an ECG done. An ECG looks at your rhythm of your heart and also the rate of your heart. If the rhythm is abnormal or is irregular, that would explain why probably the patient is present with palpitations. Or if the heartbeat is faster than 100 beats per minute, it would also explain why the patient is feeling that way. Do bloods to check for infections, inflammations. Also check your hemoglobin levels. Check if the patient is not anemic. Do electrolytes. Also calcium, magnesium, and phosphate. Do your thyroid function test. An overactive thyroid can stimulate the heart to beat faster than it's supposed to. Check your sugar levels. do drug screening in the urine. A patient who's using recreational drugs like cocaine can present with palpitations or abnormal heart rhythms in the emergency unit. Do your chest x-rays as well. And if you suspect any structural abnormalities, do your echocardiogram. Now, how do we manage Joseph who presents with palpitations? First thing is to make sure that your airway, breathing, and circulation are normal. If he is awake and talking to you, it means the airway is open and maintainable. And now you observe the breathing as he is speaking to you. Is he in respiratory distress? Is he in shortness of breath? If there is shortness of breath, give him supplemental oxygen. Also, look at your saturation on a pulse oximeter. Go to your circulation. Listen to the heart. If there are abnormal sounds you can pick from there, if there are any murmurs, if there is any abnormal beat that you can identify. Together with that, look at the ECG to see if what you hear is what you see on your ECG. An ECG that has got abnormal rhythm or a faster heart rate would tell you that there is a cardiovascular problem that is happening. Now, if your ECG tells you that this patient has got a heart rate of about 150 beats per minute and above, that has got narrow QRS complexes. So the waves that you see on an ECG, if they are narrower than they're supposed to, and they are more than 150 beats per minute according to the rate, then you know that you're dealing with a patient with a supraventricular tachycardia. In most cases, this condition is not really life-threatening, but can make a patient feel very uncomfortable. A patient who presents with such, you need to do what we call vagal maneuvers to try and slow down the heart rate. If those maneuvers are not working, then you can do drug therapy, use adenosine. If the patient is decompensating or is quite unstable, then you can go to cardioversion. I know these are too medical, but I'm just trying to highlight what happens in the emergency unit. And a patient who you've investigated fully and you think that you've excluded all possible causes, perhaps you might have to consider anxiety as one of the causes. And in that case, give them medication that would calm them down, like Ativan or Alzem, to help them be much relaxed. And do not forget to refer them to a psychiatrist or even sometimes a psychologist to find out what could be the triggering factors for this anxiety. A patient in whom you find that there is a cardiac problem that you identified, you need to refer them to a cardiologist. And if you find some systemic causes for this, like infections, you need to treat them as soon as possible, and that patient will eventually respond to the treatment that you're giving. Now, what was the outcome for Joseph? A 28-year-old male patient who presented to the emergency unit with sudden onset palpitations. He's got no known medical conditions, and he's not taking any medication. And he's not taking any stimulants or recreational drugs. We've done bloods, x-rays, we've tested the urine for presence of drugs, but everything was clear. We've done an ECG, and this one shows that he's got an abnormal heart rhythm, which we call a supraventricular tachycardia. Just a brief description on this condition. It's a type of a cardiac condition whereby there's a sudden onset of a fast heart rate, and not just fast, but very fast heart rate. A human heart rate should go to about 100 beats per minute at most under normal circumstances. But in this case, Joseph's heart rate was 185 beats per minute. So a supraventricular tachycardia happens when a patient reaches a heart rate of about 150 beats per minute or above. And looking at it on an ECG, the waves that you see on an ECG, we call them the QRS complexes. These are very, very narrow in this case. And they are regular, meaning that they are still on time, but very fast and regular. So the treatment of this condition, supraventricular tachycardia, would need a clinician to start a few things for the patient. One would be vagal maneuvers. And these maneuvers would try to slow down the heart rate. Just to give an example of one vagal maneuver, you take a straw and ask the patient to blow for about 15 seconds into that straw forcefully and sustain it for about 15 seconds. Automatically, that should slow down the heart rate. If there is no response, you would go to treatment such as adenosine, which you would put in the drip, and that under normal circumstances, it should be able to slow down your heart rate. If the patient decompensates or loses consciousness in the process of trying to assist them, you would need to do what we call cardioversion, meaning that you'd have to use a machine or a defibrillator to try and slow down the heart rate. Fortunately, Joseph responded well to adenosine, which is our second step of treatment or second option of treatment in supraventricular tachycardias. He responded well, and he was admitted to the ward where he was seen by a cardiologist. In conclusion, palpitations can have a wide range of possible causes, some of them which are simple and some can potentially be life-threatening. So, early recognition of the signs and symptoms of this condition and commencement of treatment as soon as possible can save a patient's life. And thank you for watching.